Bismillahirrahmanirrahim. Push yourself because no one else is going to do it for you. Today, the topic of my presentation is Ambiasis and Giardsis. Learning outline of my presentation is the burden of Ambiasis and Giardsis, epidemiological determinants, mode of transmission, and level of prevention of both diseases and recent advances. By the end of this presentation, participants will be able to describe the infection of Ambiasis and Giardsis and the level of prevention. Now comes the burden of disease. First, we discuss the Ambiasis. The Ambiasis is a common infection of human GI tract. There is a worldwide distribution, major health problem in China, Southeast and West Asia, Latin America, especially Mexico. Invasive Ambiasis account for about 1 lakh deaths in the world. Prevalence rate is very low as 2% to as high 60% or more in the areas where is devoid of sanitation. In high prevalence, Ambiasis occurs in endemic form as a result of high level of transmission and constant reinfection. Now we discuss the epidemiological determinants, and there are 3 determinants: agent factor, host factor, and environment factor. First, we discuss the agent factor. Ambiasis is basically caused by a pathogenic strain of Entamoeba histolytica, which exists in 2 forms: vegetative forms, which is also known as tropozoite, and cystic form. And there are 4 nuclei which is present in the cystic form of Entamoeba histolytica. Agent factor. 2 forms, tropozoite form and cystic form. Tropozoite form is short-lived outside the body and it is not important in transmission. And in cystic form, cysts are infective for several days, even outside the body. And the cystic form are not affected by adding the chlorine in the water. Host factor. All ages are susceptible and the most prone age is from 18 to 60 years. Both genders equally involved and there is no as such lifelong immunity. Poor sanitation is a main transmission of this disease. Use of night soil for agriculture, rainy season, and seepage in water supply. Man is the only reservoir of this infection, and the source of infection of this disease is basically a cases or a carrier. Carrier may be a healthy. If the carrier is healthy, then there is no transmission of disease. But if the carrier discharge the cyst in 1.5 multiplied 10 raised to power 7, then the carrier may cause the infection. Mode of transmission. There is a mode of transmission, fecal-oral route, contaminated water or food. Epidemic waterborne infection can occur. Vegetables, if eaten in raw form from that field where there is a irrigation of sewage water is done. And the vectors which are involved in the mode of transmission are flies, cockroaches, rodents which carry cysts and contaminate food and drinks. This is the life cycle of Entamoeba histolytica. Cyst and tropozoite are both passed in the feces and then they are eaten by a man. Mature cyst is ingested and then this cyst is passed into the GI tract and there is a many problem which can occur in the man and then again it passed through the feces in environment. Clinical presentation. Most common type of amoebic infection is asymptomatic cyst passage. In intestinal Intestinal amoebiasis, there is abdominal cramps with mild diarrhea to colitis and dysentery, and amoebic liver abscess, skin, genitalia, and CNS are also affected. Inflammatory and edematous reaction around trophocyte. Complication. In the complication of this disease, there is bowel perforation, GI bleeding, picture formation, fistula formation, amoebic liver abscess, peritonitis, pericarditis, emphysema, and the brain abscess. These are the complication of amoebiasis. Now comes the level of prevention. We have three levels of prevention: primary, secondary, and tertiary. In primary level of prevention, we follow two things: health promotion and specific protection. In this disease, the main focus is on the health promotion. And for the health promotion, we can educate the people about cleanliness, prevent contamination of water, food, and vegetable from human feces, safe disposal of human excreta, the protection of water supply against fecal contamination, and the food handlers must be diagnosed and treated properly. There is no as such specific protection because no vaccination currently available in developed or developing countries. Only protective measures can be taken and fight against this disease. And in secondary level of prevention, there is a early diagnosis. And for the early diagnosis, we can do a microscopy. And in microscopy, we can demonstrate the trophocyte in red cell and detection of cyst in fresh stool specimen. And for the detection of cyst in fresh stool specimen, we can collect the stool specimen in 3 times. And the next test is indirect heme agglutination test is most sensitive serological test, and the new techniques involve ELISA, which is most sensitive for invasive amoebiasis, and another test which is for counter immunoelectrophoresis. These are new techniques which can be done for the diagnosis of amoebiasis. And then the treatment, we can early treat the cases, and the first choice of drug are metronidazole followed by diloxanide furoate or tenidazole followed by diloxanide furoate, and it is given in the TDS form for 10 days. And the second choice of drug is dihydroamidine followed by diloxanide furoate. The second choice of drug is mainly used in the food for the treatment of food handlers. There is a proper surveillance system on the amoebiasis, and there is a proper case definition, laboratory criteria, and case classification on the amoebiasis. Case definition: infection of the large intestine by Entamoeba histolytica may result in an illness of variable severity ranging from mild chronic diarrhea to fulminant dysentery. Infection also may be asymptomatic, and extra-intestinal infection also can occur, for example, hepatic abscess. And there is a laboratory criteria is also present for the diagnosis and demonstration of cyst or trophocyte in stool, or the demonstration of trophocyte in tissue biopsy or ulcer scraping by culture of histopathology. And we can classify over cases on the basis of this case definition and laboratory criteria. Now comes the Giardsis. It is a global disease. It infects nearly 2% of adults and 8% of children in developed countries and 33% of people in developing countries. Epidemiological determinants agent. Giardia intestinalis is a protozoan flagellate which is main responsible for causing giardiasis, and it also exists in 2 forms: trophocyte form and cystic form. All ages are susceptible. It is also equal in both gender, and there is no lifelong immunity is present against giardiasis. And environment factors include poor sanitation, rainy season, and food handlers. Chain of transmission, man is the only reservoir of this infection, and the source of infection is cases and the carrier. Cystic mode of transmission, cyst is the infective form, contaminated food and water, person to person transmission in children, homosexual and mentally ill person. There is a life cycle of Giardsis. Transmission basically fecal-oral, ingestion of cyst more than 10 in contaminated water, food, and affecting transmission by hand. Flagellated troughs remain in small intestine, free living or attached to mucosa, self-limiting diarrhea or asymptomatic. Trough may be present in severe cases. This is the life cycle of Giardia lamblia, and you can see that there is a cystic form which is passed into the feces, and then it is again eaten by a human being by polluted water, contaminated food, and then it is ingestion is occur in by a human being, and it goes into the stomach and cause the infection like giardiasis. Clinical sign and symptom of giardiasis include diarrhea, malaise, weakness, abdominal distension, flatulence, abdominal cramps, nausea, malabsorption, weight loss, vomiting, low-grade fever. And the main complication of this disease are malabsorption, weight loss, and there is a failure to thrive. Now comes the level of prevention, and again in this disease, in the level of prevention, the main focus is on the health promotion. We can educate the people, wash hands frequently, avoid contaminated water and food, use boiled water or filtered water, prevent leakage of sewage in water pipelines. There is no role of vaccination in this disease, only preventive measures can be taken. And for the diagnostic purpose, we can do the microscopic examination of trophozoite or cystic form. It is the main diagnostic, and examination of fresh stool specimen. Drugs commonly used to treat giardiasis is included tinidazole, metronidazole, mebendazole, and albendazole and nitazoxanide. There is a proper surveillance system again on the giardiasis, and in this system we can have the proper case definition, laboratory criteria, and how we classify a case. An illness caused by the protozoan Giardia lamblia and characterized by gastrointestinal symptoms such as diarrhea, abdominal cramps, bloating, weight loss, and malabsorption. And laboratory diagnosis, we can do antigen or DNA in stool, intestinal fluid, tissue sample, biopsy, specimen, or other biological sample. There is a proper national outbreak reporting system in the developed countries. Waterborne diseases and outbreak reporting to the waterborne disease and outbreak surveillance system, which is transitioned from a paper-based system to the electronic National Outbreak Reporting System in 2009. And National Outbreak Reporting System is a web-based platform used by local, state, and tertiary health department in the United States to report all waterborne and foodborne disease outbreak and enteric disease outbreak transmitted by contact with environmental source, infected person or animal, or unknown mode of transmission to CDC. This is the references of my presentation, and now comes the MCQ session. Entamoeba histolytica cyst have nuclei.
A 1 to 4.
Correct answer. 1 to 4. Presence of ingested RBC is a characteristic feature of
Entamoeba histolytica.
Correct answer. The most common site for amoebiasis is sigmoid colon, transverse colon, cecum, hepatic flexure. The correct answer is C, cecum. Invasive amoebiasis is best diagnosed by
IHA.
ELISA. A. The best step to interrupt transmission of amoebiasis in community: filtration of drinking water.
Chlorination of drinking water.
No, chlorination is not, because chlorine is not effective against cystic form or trophozoite form. So we can do the filtration of drinking water. In an endemic area, which of the following cyst passer need to be treated: incubatory carrier, food handler cases, or a health carrier? B. Food handler. All are preventive measure against giardiasis except
Wearing mask.
yes, wearing mask is a basic preventive measure for a respiratory disease, and this is the GI disease. Giardia lamblia is communicable as long as
A.
yes, cysts are excreted in feces. The cyst of Giardia lamblia remains in the water more than 3 months, and it is infective in as long as it is present in the water. Which form of giardiasis is more dormant? Correct answer. The trophozoite form. No, it's C, cystic form. Transition from paper-based system to
2009.
electronic. 2009 is correct answer. This is the key of MCQs. Thank you.
I have a question. What is amoebic liver abscess?
Amoebic liver abscess is the collection of pus in the liver in response to an intestinal parasite called Entamoeba histolytica.
Thank you.
Amoebic liver abscess is caused by Entamoeba histolytica. This parasite causes amoebiasis in an intestinal infection, and amoebic liver abscess is the extra-intestinal manifestation of this pathogen.
Thank you so much. Allah Hafiz.